Hi. Welcome to Zoe Health and Wellness YouTube channel and Facebook page. Today, in this Zoe Health and Wellness video, we are going to talk about cardiovascular disease. According to the World Health Organization, WHO, cardiovascular diseases, CVDs, are the #1 cause of death globally, taking an estimated 17.9 million lives each year. CVDs are a group of disorders of the heart and blood vessels and include coronary heart disease, cerebrovascular disease, rheumatic heart disease and other conditions. 4 out of 5 CVD deaths are due to heart attacks and strokes, and 1/3 of these deaths occur prematurely in people under 70 years of age. Below are the key facts from the World Health Organization. CVDs are the #1 cause of death globally. More people die annually from CVDs than from any other cause. An estimated 17.9 million people died from CVDs in 2016, representing 31% of all global deaths. Of these deaths, 85% are due to heart attack and stroke. Over 3/4 of CVD deaths take place in low and middle income countries. Out of the 17 million premature deaths, under the age of 70, due to non-communicable diseases in 2015, 82% are in low and middle income countries, and 37% are caused by CVDs. Most cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity and harmful use of alcohol using population-wide strategies. People with cardiovascular disease or who are at high cardiovascular risk, due to the presence of one or more risk factors such as hypertension, diabetes, hyperlipidemia or already established disease, need early detection and management using counseling and medicines, as appropriate. Cardiovascular disease, CVD, is a category of diseases that involve the heart or blood vessels. CVD includes coronary artery diseases, CAD, such as angina and myocardial infarction, commonly known as a heart attack. Cardiovascular diseases, CVDs, are a group of disorders of the heart and blood vessels, and they include coronary heart disease, disease of the blood vessels supplying the heart muscle; cerebrovascular disease, disease of the blood vessels supplying the brain; peripheral arterial disease, disease of blood vessels supplying the arms and legs; rheumatic heart disease, damage to the heart muscle and heart valves from rheumatic fever, caused by streptococcal bacteria; congenital heart disease, malformations of heart structure existing at birth; deep vein thrombosis and pulmonary embolism, blood clots in the leg veins, which can dislodge and move to the heart and lungs. Heart attacks and strokes are usually acute events and are mainly caused by a blockage that prevents blood from flowing to the heart or brain. The most common reason for this is a buildup of fatty deposits on the inner walls of the blood vessels that supply the heart or brain. Strokes can also be caused by bleeding from a blood vessel in the brain or from blood clots. The key causes and the most important behavioral risk factors of CVD, heart disease and stroke, are unhealthy diet, unhealthy lifestyle and physical inactivity or lack of exercise, tobacco use and also the harmful use of alcohol, hypertension, diabetes and hyperlipidemia. The cause and effects of behavioral risk factors as mentioned above may happen in individuals when their blood pressure raised to abnormal levels, blood glucose irregularity, increased in the blood lipids, overweight and obesity. What are some of the early warning signs and symptoms of CVD or heart disease? Please take note of these symptoms and get professional consultation with your doctors to avoid serious consequences. The common symptoms of cardiovascular diseases: pain or discomfort in the center of the chest, pain or discomfort in the arms, the left shoulder, elbows, jaw, or back. The person may experience difficulty in breathing or shortness of breath, feeling sick or vomiting, feeling light-headed or faint, breaking into a cold sweat, and becoming pale. Women are more likely to have shortness of breath, nausea, vomiting, and back or jaw pain. The most common symptom of a stroke is sudden weakness of the face, arm, or leg, most often on one side of the body. Other symptoms include sudden onset of numbness of the face, arm, or leg, especially on one side of the body; confusion, difficulty speaking or understanding speech; difficulty seeing with one or both eyes, difficulty walking, dizziness, loss of balance or coordination, severe headache with no known cause, and fainting or unconsciousness. People experiencing these symptoms should seek medical care immediately. Can CVD, cardiovascular disease, be cured? The good news is most forms of CVD heart disease are treatable with today's modern science and technology. Although we can't cure heart disease, we can make it better. Normalizing the high blood pressure and reducing or lowering of high cholesterol levels will help to partially reverse the plaques in the coronary arteries. That's it for now. We tend to hope you learned a few tips through this Zoe Health and Wellness video. May God bless you with good health, prosperity, happy life and great success all the days of your life. Take care. Do remember to give a thumbs up and subscribe to Zoe Health and Wellness YouTube channel. Thanks for watching.